I'm Rosa Vivian Fernandez, and I'm the CEO of Benito Health Foundation. We're both a migrant health center and a community health center, and we're the safety net for our community. So we provide services regardless of ability to pay, and we access resources at an affordable and quality fashion for all of our communities. So we're the place that people can depend on. Well, this project came to be as part of an emergency preparedness after the Hurricane Maria in Puerto Rico. Many of the community health centers had to close down, and it was not just at the first impact of the hurricane, but for months later. And they lost their medications and their vaccines at a critical time during the flu season and a critical time of need for the community. When I came back and I talked to our board of what I had seen. Our board was adamant that our patients would not be placed in that position if we could. And we currently have a generator that is installed and is seamless in our clinic. But if we were to have to go through the same in an extended period of time, we wanted to ensure that we would have the resources available to sustain services 24/7. Okay, so the way that we would achieve that is through developing some resiliency to the system. So we do have our diesel generator, but we are going to also utilize the power of the sun that is free to us, and installing the panels, the solar power panels, and also a backup battery to store the power that is gained during the sunny periods of the day. And so we would have in a period of loss of energy, a prolonged loss of energy, then we would have the solar power and the battery as a backup. And if there's an extended period, then the generator itself, the current generator that would be converted to biofuels, would then kick on and add a third level of resiliency. Part of this project is not just adding the solar power, but also becoming energy efficient and environmentally conscious, because we have limited resources in the planet. In addition to that, our energy costs continue to grow and grow throughout the years. So we see it that at the long term, it will result in savings to the organization that we can further invest in service delivery.